Vectors. The human face does not age uniformly. There are fixed areas and mobile areas. Fixed areas of the face, F1 and F3, generally remain in the same position. They work as anchoring points for the skin and muscles through fixed anatomical elements. Superficial temporal and parotid masseter fascia for the metaface, F3, and frontonasal maxillary bone structures for the mesoface, F1. The supportive ligaments also offer additional reinforcement for the face structure. Mobile areas, M2, are located between the fixed areas of the face and are the most affected by the force of gravity. These mobile areas are essentially made up of the fat compartments of the face, which tend to separate, reduce in volume, and gradually sag. The fat loss and ptosis of adipose compartments are associated with the laxity of the skin and distension of the facial ligaments, and cause the face to sag and the appearance of folds and wrinkles. These dynamic and volume changes in the face's anatomical elements can be considered as negative vectors to aging. The physiological vector of aging has a negative direction, since it moves downward and inward, given the mobility of the medial part of each hemiface, which undergoes medial and vertical tissue ptosis. It is also a three-dimensional vector, given the generally associated loss in volume. Changing these negative vectors to the opposite direction, positive vectors, allows replacement of each compartment or anatomical unit at its original position. More than simply filling wrinkles, folds, or ptosis, the positive corrective vectors offer lateral and vertical replacement, while repairing the loss of volume and correcting in the three dimensions. This is the medical lift based on three vectors along the following directions. The nasolabial fold, traction of the fold and correction of the malar and suborbital volumes. Marionette lines, traction of line and correction of the anterior jugal volumes. Jowls, traction of jowl and correction of posterior jugal volumes. This technique requires an exhaustive analysis of physiological vectors and face volumes on the part of the practitioner. The indication is more for long, thin faces. A vector has a constant high and lateral anchoring point corresponding to the fixed zone of the zygomatic arch, or just above, and a lower and more medial end which can correspond to three different targets: nasolabial fold, marionette lines, jowls. The vector runs along a guiding line from an anchoring point and toward the middle of the target or the indication to treat. It corresponds to a group of fans of retrotracing lines overlapping at their ends and in variable numbers, depending on the distance between the anchoring point and the target based on physiognomy. The needle or cannula is inserted at the upper end of the vector, at the anchoring point, and injections are made along the length of the guideline using a fanning technique. The second or even the third fan supports one of the branches of the previous fan and follows the same guideline until the target. The nasolabial fold vectors and marionette lines can cross the latter to ensure filling downstream from the indication. This filling is considered gradual. The jowl vector must stop at least 1 centimeter from the mandibular edge to avoid making this fatty mass heavier when depositing the product. After disinfecting, make a pre-hole with the needle to the upper end of the vector until the dermic-hypodermic junction, and insert the cannula parallel to the cutaneous plane in the desired injection plane. Make the retrotracing injection by removing the syringe to obtain a linear and homogeneous Radiesse deposit. Without removing the end of the cannula from the skin, change its direction and inject as many new lines as needed. The adjacent product lines are fanned out while limiting the number of injection points. The second and third fan, if necessary, take the insertion from one of the retrotracing lines of the previous fan, following the same fanning injection technique along the same injection axis. With Radiesse, the product deposit and correlated correction are assessed immediately. Massage and shape the areas injected to evenly spread the product deposit. The nasolabial fold vectors, marionette lines and jowls can also be injected using the needle using the same techniques. Here are the results obtained using the Radiesse injection along the nasolabial fold vector, the marionette lines vector and the jowls vector. In certain cases, additional treatments may be necessary, depending on the extent of the area to be corrected and the patient's needs.